Well, I'm sure there's been some confusion about having asthma and the effects of the coronavirus. And it's really because, like every other component of this thing, we're really just not that sure of things. But what it appears is that having asthma does increase your risk for having a complicated response to the virus. Now, what does that mean? Certainly, some of the patients who get coronavirus infections are going to have various degrees of lung and breathing abnormalities, as we have heard. And some of those people are going to end up on ventilators, and some of them in the ICU because of the severity of their disease. But like any other virus, many patients with asthma will have their asthma triggered by the exposure to this virus. This virus is in the family of the coronaviruses, and as you know, every winter viruses can cause you to have an increase in your symptoms. The real important thing, however, is how do we approach this when we know we have asthma? And the answer to that is manage your asthma effectively. Despite this risk, what's really important is that you do all the things that you already know to do for your asthma. And to also understand that all of the things that trigger your asthma, like changes in temperature and wind blowing and viral infections that are not the coronavirus, all of them can cause you to have symptoms just like they always have. What's important to distinguish is if you think the symptom process is different, is more severe, and even then one should just aggressively first treat your asthma as you normally would do. But if your symptoms worsen, then you would go to the hospital, or at least speak to your physician first and decide whether or not therapy needs to be simply adjusted at home, or if a more aggressive approach is necessary. So take your medications as prescribed. Now, one of the things that people have questioned is whether or not they should take inhaled steroids with this epidemic. And the answer is yes. There is no evidence that taking your inhaled steroids are going to increase your risk of having this infection. If you're on prednisone or oral steroids, the risk does go up some, but that's something that you talk to your physician about and manage with them, because the first thing, again, is for you to maximally manage your asthma as the most effective way for you to control your symptoms. I think that's important. I think people should understand that what they need to do is get their medicines, get reasonable supplies of their medicines, and then at the same time do all of the things that you've already heard in terms of managing the viral risk. Wash your hands, keep your distance, cough with it controlled in your sleeve, and just do all the things that have already been suggested for control of the virus while managing your asthma as best you can.